Hello and welcome to MTV's Infocus. I'm Bradley Valenaki. Tonight, COVID-19 containment measures, and they are now being enforced on public transport. And in the studio with me, I'm privileged to have Mr. Nelson Terema, the CEO of RTA. Sir, welcome to the program.
Thank you.
Sir, so the measures have been introduced by the controller, David Manning. What's been done now?
After the commander or the controller released the orders, the NCDC took a lead by inviting all various stakeholders like Road Traffic Authority, NCDC, police and the defense to meet and discuss issues way forward, how we can manage public transport in Port Moresby to address COVID-19. So we have a couple of meetings. Now, yesterday we commenced our operations. We have reallocated the city routes from Unangi Field to various locations just around Gordon's area and to minimize the crowd at Unangi Field. So you will see that certain tents being erected in several locations in Gordon's, Wageni, Gareu, Manu. Major bus terminals, we have set up tents where it's going to be stationed and controlled by the enforcement officers from Road Traffic Authority, supported by police, defense force, and NCDC traffic unit, enforcement unit. We will be stationing at those locations, and we will monitor the situation, making sure that COVID-19 protocols are being implemented and carried out in the public transport.
All right, so we understand apart from those outside of Port Moresby still remains the most sophisticated, if you will, in terms of public transport. We have the buses, we also have PMVs, trucks coming into Port Moresby, but also we have the taxi services operating. It must be a challenge also from the experience of 2020, where you were also brought in.
Yes, it's a big challenge ahead of us because of the population in Port Moresby, and also the developments are taking place in Port Moresby. It's very challenge for the agencies concerned to address COVID-19 in the public transport. So what we are planning to do is only to monitor and manage the major bus terminals so that the buses, they come through those bus stops to do their businesses. So at the moment we are only concentrating on those particular bus terminals, but of course there are some other routes, city routes. I mean, there are provinces like Kerema and central provinces, they are coming in. So those are the areas that we are also looking at.
All right, so you talked about the bus stops. So what about roadblocks?
Roadblocks, at the moment, we are not really in the roadblock. We are only because of the COVID-19. We making sure that COVID-19 protocols are being implemented, the orders are being implemented by the road users. At the same time, the operators of the PMVs, they must be carried out in the public transport. But for roadblocks, at the moment, we can't do that because we are only focusing on how we can manage public transport to avoid the disease, COVID-19.
All right. So at the moment, the current measures, mask wearing is mandatory and is a requirement. And also we have a ceiling of how many passengers should be there in a vehicle or a bus or a PMV truck for that matter.
Yes. At the moment, we are enforcing and making sure that all passengers must wear face masks. Before the entry, the duty of the crew in the bus or the driver of the taxi, making sure that the passenger that hopping onto the bus or a PMV must wear face masks, and the crew must making sure that he must have an hand sanitizer at the doorway. Any passenger entering the bus or a taxi must be sanitized, so safe inside. And also, for the purpose of social distancing, all passengers must carry 15 passengers. And we will revisit the initial fare, which was in Loc 1. We have ICCC, and we agreed that all 25 seaters must carry 15 passengers, and the fare must be 150 toya. So at the moment, under the new look, new normal protocols, we are still going to implement the initial 150 until ICCC decides.
All right. So we also have seen, as per the requirements from the Controller's Office, calling on those service providers, which are the public transport providers, to also have proper equipment for wash down of the vehicles. Is that been monitored to some extent?
Yes, at the moment we did awareness to all the operators recently with the Road Traffic Authority Management. We met with all the PMBs and taxi owners that they have to take some ownership as well. They have to wash their own buses, taxis after work. In the night they can wash it and making sure that it must be both clean in and out before they come out and conduct their business in the morning. But at the moment we haven't any facilities, but that is something we are thinking of addressing in the near future. So to put up, car wash areas next to the tent or so, but like I said, some of the issues we will, as we move on, we will address them as time goes. So, but in the meantime, we have passed that sort of responsibility back to the owners to making sure that their taxis and the buses must be clean both in and out before they come out on daily basis.
And if they do not adhere to these measures, there are serious consequences, according to the statements here, losing their license.
Yes, that's some of the requirements that we want during the awareness campaign. We ask them to making sure that the owners, their duty is to advise the crew and the drivers to comply with the requirements. And if they fail, and our team having to see that if the driver and crew are not complying with the safety measures, then we have no choice but only to revoke their licenses.
Okay, so the period of monitoring the measures that are in place and to do the right thing, what time do your officers actually monitor that? From morning till afternoon? What specific duration or time frame in a day do they actually do this compliance work?
Like what I said earlier, we have tents stationed at different bus terminals, so our officers are stationed there from morning to afternoon till 4 o'clock. So they continuously monitor because PMBs and the taxis they're operating on, and there's no specific timing. So anytime they are every now and then. So our duty is to station at a tent to making sure that they comply.
All right. So we spoke about the capacity and the resources to enforce this. Realistically speaking, can we carry out all these things, or we still need more time in this?
Definitely, that is the biggest challenge. Now we need, the challenge is we must be fully equipped with logistics and resources. At the moment, the various agencies like Road Traffic Authority, we are unable to, supply masks and hand sanitizers every day. So that is a challenge that needs to be addressed. But we have conducted the awareness that the operators must take the ownership as well. Even the general public too, they must have these basics with them. Because what if we don't provide? We have to be proactive in making sure that we have our own masks and sanitizers. We're making sure that we look after ourselves at the first place.
And it should be a shared responsibility
yes.
in this. Yes, look, Mr. Terema, thank you very much for your time. This is In Focus. We will continue with more of the discussions on the other side. Welcome back. This is In Focus. We now take a look at the public transport measures and what's happening on the streets of Port Moresby with regards to the response.
Basically, our enforcement strategy and the previous awareness that we have done so far is in line with the controller's order and also the Department of Health, the COVID-19 protocols, and also the NCD Provincial Health Authority directives as well. So we are basically the operation side of the municipal authority, which is the city authority. So everything we're doing is all in line with what the government is doing in terms of the basic COVID-19 protocols. We previously did, I think, 3 or 5 days of awareness. We went out to 75 hotspots, or say crowded areas, and we did awareness. So if you just see at the background here, we have been supported by the MedSup and the police in NCD, and we also have our military police from the Defence Force who are also assisting, all under the arrangement of the controller. And we also have NCDC health officers and NCDC reserve police. And we also have with us Pacific Corporate Services, a security firm who is also assisting in this enforcement. So the support has been overwhelming. We've tried to concentrate on the bigger areas, the public areas, the hotspots or the crowded areas. That's Unagi. And similar arrangement setup is in Manuata Port, and also one at Waigani down at Waigani down there. So similar arrangements. So those 3 areas we will continue for a week or 2, and slowly we will colonize the area, meaning that we will try to expand the operations, and then go into other small areas. But these are the key areas we want to colonize, or we want to take control of.
COVID-19 operation started last Monday. So far we have maintained 1 week. This is another week starting now.
As me looking at myself, plan to man marry a club of bus, but I want to take him this risk. I want to take him one big problem, or take him normal. Now most of them are not serious about wearing the mask.
This 1 week, and this protocols on government, and government put the 2 weeks. 1 week me looking at as some poskuru me looking at Samblam been some one me league. All been benim this low league na Sambla no got. Sambla was low side blooming poskuru me send down lombas na smila collect the milukumem. Sambla is all very good. All benim this protocol where government been giving.
Karem plantilan nimi karon kan man mermi bla karon so ino place bla raushim mask na olim na kargam safety bla me big la sandi so me bla mas only one time na put the mask na club la card so that you can bianim the slow protocols where government put them bla 2 weeks later you must bianim na after that and bianim no raushim mask na round us lagan.
This is In Focus. We will continue with more on the other side. Welcome back. Now we look at Professor Glenn Moller's statement on COVID-19 and what the response looks like at the Port Moresby General Hospital.
I'm Glenn Moller, Professor of Obstetrics, Gynecology, Reproductive Health at the School of Medicine, Health Sciences at Port Moresby General Hospital. I'm 74 years old and I'm very much at risk of serious morbidity or perhaps death if I get this COVID-19 infection. And here I am in PMGH working where something like 30% of those with a cough or a fever or any other indication of a respiratory infection, we're testing all these people and 30% of them are positive. And we health workers are caring for these people because that is our job.
We are decontaminating this place. We have our staff tested.
We're now approaching 2,000 positive cases and more than 20 people have died. More than half of the deaths have occurred in the last couple of weeks. And we're going to see more deaths in the very near future. We should all do our very best to slow it as much as possible. Put the mask at a time, stop long way, or narapla. Wash him hand, long slow him, walk about, because if the number of new infections is such that there are too many sick people for our health system to cope with, the health system will collapse. It will literally collapse. Possibly the health workers will all go home, and then where are we? But then there is a vaccine. Now, vaccines prevent illness. This vaccine has been produced in the best laboratories in the world. It's been tested on thousands of people, and now it's being used already in millions of people without bad effects. So let's get behind this vaccine. I mean, I want it yesterday. We have an ethical responsibility to our profession, to our countrymen, to keep on working. But gee, we want to protect ourselves as much as possible, which is what the vaccine is. Protection. And particularly, it protects you against getting sick and dying from it.
That video produced by WHO and the Department of Health, that was Professor Glenn Moller, a lecturer, senior lecturer at the UPNG School of Medicine, and also a person who's been at POMGEN for a very long time here in the country. Now, he made some very profound statements about vaccination and also the response here at the Port Moresby General Hospital. Similar sentiments were echoed by Dr. Sam Yokopua last week when MTV cameras were allowed into the emergency department of the hospital, where we saw for the first time the nature of the response at hand and those that were turning up at the hospital with COVID-19.
10 beds, all the 10 beds are full. We have moved some of the patients to the isolation ward on the other side. It's full, the 16 beds are full. We've moved some to Ritterflin. The Ritterflin is about 80% full at the moment.
Situation here in Papua New Guinea, and with the already burdened health systems we have in the country, with the shortage of staff at POMGEN due to COVID-19, these sentiments were shared. So this brought to light in a time where the country is experiencing cases right throughout the country, but notably here in Port Moresby, and you would have seen from the pictures from the Port Moresby General Hospital Emergency Department.
The second wave of patients we're seeing, they typically present with low oxygen level for some mechanisms. Their lungs are flushed, and so the amount of oxygen being transferred from the atmosphere into the blood circulation is affected due to the flushing of the lungs. And in medical term, we call it organized pneumonia. Okay, it is something different to the normal pneumonia we get. And first thing they present is shortness of breath, and we assess, and this is what they get. This is a live patient we're looking at. This is 83%.
From the statements, they said that there is likely or a possibility for them to ask for volunteers to come in and assist where there is a need. So at the moment, 90% of hospital staff have given their okay to receive the COVID-19 vaccine, which is already in country. So that's a reassuring statement, and also an indication that the health staff in Port Moresby are willing to take the first step in taking the AstraZeneca COVID-19 vaccine, which is here in Papua New Guinea. Well, that's all we have time for tonight. We appreciate your company. If you have comments on tonight's program, you can engage with us social on our Facebook page. We'll be more than willing to hear from you. Or you can watch this program a little later on YouTube. Stay safe. Bye for now.